If you've ever noticed redness, bumps, or sensitivity on your skin and you're wondering what's going on, you might be dealing with a condition called rosacea. And here's what you need to know. I'm Dr. Nina Desai, board-certified dermatologist and mom of 4. My goal is to help you find solutions to your skincare concerns and share a little bit about my life. Don't forget to subscribe so you don't miss a video. So what is rosacea? Rosacea is a chronic inflammatory condition, and on your skin, what you can notice is redness or flushing, broken blood vessels, bumps that look like acne. You can even have eye symptoms with redness and tearing in your eyes, which is known as ocular rosacea. Because one of the primary findings of rosacea is redness and flushing, we oftentimes diagnose rosacea more commonly in those with fairer skin tones, skin types 1, 2, and 3. This is not to say that it can't happen in darker skin tones, it's just more apparent in those with fairer skin tones. So there are 4 main categories of rosacea. The first is erythemotelangiectatic rosacea, which is basically the vasodilation of the blood vessels that you see on the surface of the skin. This form of rosacea is going to look like a lot of redness on the face. There's going to be flushing. So when your face gets hot or you're exposed to certain triggers, you're going to notice that the face feels more warm and more red. You can also have sensations such as stinging or burning in this type of rosacea. Next is papulopustular rosacea. This type of rosacea is most often confused with acne. In papulopustular rosacea, you are going to see papules, which are red and inflamed bumps, and pustules, which are fluid-filled and sometimes can have this whitish look to them. What you are going to be missing in this type of rosacea that you'll find in acne is what are known as comedones. So typically, this type of rosacea will not have blackheads or whiteheads like traditional acne will. This type of rosacea primarily appears on the cheeks, the nose, and the chin. Next, we have phymatous rosacea. Now, this is one of the long-term complications of having rosacea that flares over years and years and years, and this will lead to skin thickening. Most individuals will notice this happening around the nose area where the tissue becomes very thick and very firm. This is called rhinophyma, and the nose has this very bulbous appearance to it. Phymatous rosacea oftentimes will happen more commonly in men than women, and this is not an acute condition. Phymatous rosacea is something that you develop over years and years of untreated inflammatory rosacea happening on the skin. And lastly, there's ocular rosacea. Ocular rosacea can occur on its own or with skin findings as well. And what you're going to notice is the redness of the eyes. They appear bloodshot. There can be stinging and watering in the eyes, and the eyes can be very sensitive to light. In severe cases, someone may also have blurry vision. I typically recommend seeing an ophthalmologist if you have symptoms of ocular rosacea. While oftentimes we can't identify the exact cause of rosacea, we know that it's an inflammatory condition, and oftentimes it is an upregulation of your body's immune response. A lot of individuals will have an upregulation to an overgrowth of what's known as the Demodex mite. The Demodex mite naturally lives on the surface of our skin, but we find that individuals who have rosacea will oftentimes have an upregulation of this mite that will then trigger the inflammatory response. There's also environmental and genetic factors that play into the development of rosacea. Another important thing to understand about rosacea is that there are oftentimes certain triggers that will make it flare. And these include things that help to vasodilate those blood vessels and really get the body's temperature up. So sun, heat, spicy foods, excessive exercise, alcohol, hormonal changes. These are all things that can trigger your rosacea to flare. So how do we treat rosacea? First, it's really important to work closely with your dermatologist to get your rosacea diagnosed and under control. First and foremost, I'll talk to my clients about their particular triggers, and we'll see what we can do to eliminate those triggers or to minimize them. Next, we'll work on treating the symptoms of the rosacea. If someone has papulopustular rosacea, we really want to get topical antibiotics on board and even medications that help control the Demodex mite. So anti-mite medications might also be used, either topically or orally or both. Some of these medications include creams such as metronidazole and azelaic acid, or Soolantra, which is ivermectin. Sometimes we'll even use oral anti-inflammatories like low-dose doxycycline to get the inflammation under control. So one of the most important things to understand about the treatment of rosacea is that this is a chronic condition. Unfortunately, we're not going to be able to cure it and say your rosacea is never going to flare again. That's why managing your triggers is really important, and being on a good topical regimen is really important. Sometimes I will do short courses of the oral antibiotics to get the inflammation under control, but because of the chronic nature of this condition, it's all about managing the symptoms and managing those triggers. In terms of treatment, if someone comes in with lots of redness and broken capillaries, we really do talk about lasers. So the best way to reduce the redness on the surface of the skin when it's caused by these vasodilated capillaries is to use laser energy to clamp down the blood vessels. There are multiple lasers we can use for this, including broadband light, which is BBL, XLV, or even V-beam laser. These are all vascular lasers that have specific wavelengths to clamp down the blood vessels to reduce the redness on the surface of the skin. This typically takes multiple treatments, and we are going to do treatments once a month for a series of sometimes between 3 and 5, depending on how much redness you have. But again, the important thing to understand is that because rosacea is a chronic condition, this redness can come back. So I always counsel my patients on needing maintenance treatments as well. So of course, laser treatments are an investment. And if you're going to invest in this type of treatment, it's really important to understand that we do want to control our triggers. So if you're one who flares because of sun exposure or excessive exercise, when you're getting your laser treatments done, I typically have my clients minimize those exposures to really clamp down those vessels and get the best results possible. And typically I'll have them do this for a few days after each treatment. So another really important part of managing your rosacea is your at-home skincare routine. Rosacea, as we now know, is an inflammatory condition in which the skin can get easily irritated. So it's really important to have a very gentle skincare routine when you are dealing with rosacea. I always have my clients look for lines that are fragrance-free and are marketed for sensitive skin. I will also make sure that they're looking for ingredients that help to protect the skin barrier and reduce inflammation. In terms of these ingredients, when you're looking for things to help protect the skin barrier, we're looking for ingredients such as ceramides and hyaluronic acid and glycerin. And we're looking for ingredients that are going to help combat the inflammation of rosacea. We're looking for ingredients such as niacinamide, sulfur, azelaic acid, just to name a few that are really amazing for rosacea-prone individuals. So what are my favorite products for individuals with rosacea? First, I absolutely love the Aven line. The Aven Tolerance Soothing Skin Recovery Cream for sensitive skin is an amazing product for anyone with rosacea or even just really sensitive skin. This is a lightweight formula that has postbiotics that are really going to help calm down redness and tightness on the surface of the skin. Next, we have the Skin Better Science Maestro. This product is a very unique combination of what are known as adaptogens, which help the skin to respond to stress. This will help to achieve a better balance and more calmness on the surface of the skin. Next, we've got the IS Clinical Pro Heal Serum. Now, this product is a 15% L-ascorbic acid, but it is very gentle on the surface of the skin and is compounded with copper peptides. These ingredients together really help soothe the skin, calm down any irritation, and are a perfect choice for anyone with rosacea. And when it comes to cleansers, there's one clear favorite that I have. Oftentimes, as a dermatologist, I will prescribe a sulfur-based cleanser to help calm down inflammation and help kill any of that Demodex mite that I mentioned. But there's an over-the-counter sulfur soap called the Joseph Anti-Acne Soap, and this product is a wonderful alternative to a prescription-strength sulfur product. And of course, no rosacea routine is complete without a wonderful sunscreen. As you know, the sun will make your rosacea flare. It will make that flushing happen more often. It will make the redness more apparent. So using a sunscreen consistently is really important. So some of my favorites are the Elta MD UV Clear. This sunscreen not only has great protection from UV damage, it also has niacinamide in it. Niacinamide is going to help calm down that redness and that inflammation on the skin, so it's a perfect choice for anyone with rosacea. It does come in a non-tinted and a tinted formulation. Next, we've got the La Roche-Posay Antelios mineral sunscreen. This also comes as a tinted and a non-tinted sunscreen. Mineral sunscreens are wonderful for individuals who have really sensitive skin, such as those with rosacea. This sunscreen has a powerful antioxidant complex, which is going to help protect the skin from environmental damage and free radical formation, which is also going to minimize irritation on the skin. The tinted formulation also has iron oxides in it to help protect against visible light as well. Next, we've got the Isden Aerofotona Ageless Mineral Tinted Sunscreen. Now, this sunscreen has a unique property known as DNA repairsomes. This is not only going to help protect the skin from environmental damage and sun damage, it's actually going to repair some of the sun damage and environmental damage that has already happened. So this is a perfect choice for anyone with redness on the surface of their skin or who is really sensitive. Do you have any rosacea tips to share? Comment below and don't forget to like and subscribe to my channel so you don't miss a video.